And good morning, everyone. Thank you so much for joining us here on this Wednesday morning. I had to kind of stop there for a second. On this Wednesday morning for our, what is right now turned into a bi-weekly session of All's in This Together. I am here with, as always, with my colleague, friend, and cohort, partner in crime,
Mindy Castro.
the lovely and talented Mindy Castro. Good morning, Mindy.
Good morning, Jerry, and we're so happy to be here. You know, I was thinking just a little bit ago, we're about, and correct me if I'm wrong, about 6 or 7 weeks away from this year's walk. Walk to End
4th.
Alzheimer's, exactly. November 4th. So we are probably already in the counting down phase of the walk, and we're, doing really extremely well. We really want to give a big shout out to everybody out there in the community who has stepped up this year to really support this year's walk. I think it's going to be one of the biggest ones we've seen so far.
So let's see. So today's September the 20th.
Right.
So 10 days before the end of the month. So that's
right.
10, and then 31, it's 41, and then 4, that's 45.
Yeah.
That's 6 weeks away.
6 weeks away.
Right?
We're so
right?
close. Your math is right. And once again, it's going to be held at Texas A&M International University. It's always a beautiful campus, of course, and we're excited that we are just 6 weeks away. So before we get started with a really good episode of All's in This Together, we just want to remind everybody to go to the website, sign up your team for the walk November 4th. Once again, it doesn't cost anything to register. We just ask for, some small donations on the day of the walk to be submitted, of course. And as we always say, every penny counts towards research and towards support for such a great cause.
We've been doing this for 2 years already. I can feel the energy that so far we are doing really, really well. Yeah, and I know we kind of started, because we started in June. All right, you know what? It's still in November. All right, no, we're 6 weeks away. So now we're just kind of moving into that second phase. It's got a little bit more urgency there. And let's get people signed up for the walk. Last year's walk was incredible. We really want to blow last year's walk out of the water.
Right.
And just a sea of purple at TAMU, and I know we can do it. We got a fantastic community. People in this town really come together for all of these great causes and great events, and there are so many great causes and events in this town. But this I would certainly rank up there with them. And we know that when you ask the community for help, they come through.
Yeah, absolutely. And speaking of asking the community for help, just this past week, we had this fantastic announcement, an amazing, mind-blowing announcement from International Bank of Commerce, who always does step up to meet the needs of the community. And we were so excited to be able to announce a $50,000 donation from IBC. It was just, wow, you just couldn't help but tear up when they spoke. Jerry Schrebel spoke, of course, talking about why this is such an important cause for IBC to back. And we were just so thrilled to be able to receive that donation. So thank you to IBC and to so many other sponsors who have stepped up this year. Last year we were a little worried because we were just coming out of the pandemic. So we weren't too sure how we were going to do with sponsors and with teams, but we did really well last year. This year, though, it seems as if people have really embraced what the organization does and what they're fighting for, and the sponsorships, and have just been amazing this year.
Well, and it's like they say, you start something, and at some point you reach that tipping point, and it just takes out. You do all this hard work, and and then at some point you just reach that tipping point, and then it just takes off. And I think obviously there've been so many people who've done such a tremendous amount of work, but I really do think we've hit that tipping point where we're starting to really, things are really starting to grow. I don't want to say exponentially, that's very cliche-ish, but it really does feel like that. That just things like, wow, it's like one good announcement after another, after another. And obviously we're gonna talk more about walk in just a little bit, but we got a couple of great guests with us here this morning, and one of the guests is obviously somebody who is a regular on our program. PV, thank you so much for being here. There she is. Hey, PV, good morning. Before we get to our other guest, our new guest here this morning, and we'll introduce him in a minute. You got to get a little preview of him right there. But PV, isn't it just been amazing how everything has gone so far this year, and the amount of sponsorships and everything that we've gotten? It just seems like things are really, really taking off.
and even before walk. And I think that the teams in the community are definitely supporting all of our efforts. So that is exciting. We're hoping to see over 800 to 1,000 people at the walk itself. But so far, all of it has been just phenomenal going through. So we're at the tail end of sponsorship. So this is the time that I say it turns into crazy time. But once we're at walk, we definitely reap all of those rewards just to be there with our community and to see how everything has come together and how we can support them through this walk.
Yeah, it is. And we'll get, you can stand by. We'll get back to you a little later on, talk more about that. But I really do want to get to our other guest here this morning who has been standing by very patiently, Dr. Carl Hill. Dr. Hill, good morning. Thanks for joining us here on All's in This Together. Just a little, you've got an impressive bio, Dr. Hill. He is the Chief Diversity, Equity, and Inclusion Officer for the Alzheimer's Association. And in that role, part of his job is to oversee the strategic initiatives to strengthen the association's outreach to all populations and providing communities with resources to address the Alzheimer's crisis. Dr. Hill, thank you so much for joining us here this morning.
Oh, good morning. Thank you for having me. So excited about today's conversation and really amped about November 4th. I tell you, when the community responds, walk is amazing. So kudos and thank you for all of your leadership and support. Really excited about it.
So you have a pretty tall task there with the Alzheimer's Association, Chief Diversity, Equity, and Inclusion Officer. So in a nutshell, Dr. Hill, what is it you do for the Alzheimer's Association?
I tell you, a nutshell is tough, but really excited about our progress in diversity, equity, and inclusion. My job is to make sure that we're thinking, with innovation internally to make sure that everyone's on board with our need to, really champion diversity, really understand that, people have different needs and they come to Alzheimer's and dementia from different perspectives, to be intentional about including those perspectives, and then really focusing in on equity, which, really is, making sure that everyone, we're thinking about, ways to make sure everyone has the highest level of health, where everyone has a fair and just opportunity to obtain their optimal health, regardless of where they live or how much money they make or their race or ethnicity. We want to give people resources in a way that they can use them, and that's what equity is. So it's a tall order, but I truly believe it's what's right, it's what's fair, and what's just, and believing that, I believe we're on the right side of this momentum. Yeah.
So, Dr. Hill, once again, thank you so much for joining us this morning, because this topic is so important, and because we live in a heavily minority community that with very high numbers, of course, of dementia and Alzheimer's. So as an organization with Alzheimer's, how do you ensure that all underrepresented minority groups are receiving equitable healthcare and treatments and trial clinics and all of that? How do you make sure that everybody is getting the same treatments?
Yeah, really, really great question. And, it is the journey of, I would always say, pursuing health equity. I was talking to PV just a minute ago and just saying that, we're always understanding and discovering new communities. So our pursuit of health equity, seemingly will never end, and that's okay, because it's our job to make sure that we are, again, identifying communities and people with diverse needs, and then shaping our resources to meet those needs. So as background, I'm a researcher by training. I spent many years, training and conducting health disparities research, and we would always come to the finding that we've got to get these populations who are, we call them disproportionately affected, or in this case, more likely to have Alzheimer's or another dementia. We've got to get them the resources. We need a equal access to resources. And, we're rethinking that a bit, and it's not just equal access, but it's equitable access. And so the association, is in a prime position with our chapters. We have, a chapter right there in Laredo, chapters all over the country that are physically working in communities, step by step, to provide these resources, in a equitable way. And when I say equitable, it's, taking into account all of the factors in communities that could be different. What's happening in Laredo is different than what's happening in Dallas or in Houston, right? So taking into account of some of those, sociocultural, environmental differences, bringing together local organizations. You mentioned the sponsorships and all of the organizations that are supporting WALK. That is community, and that's different all over the country. And then coming up with ways to get our, resources like information about Alzheimer's and dementia, support for caregivers, or referrals to neurologists and dementia care specialists. Delivering those in a what I might call a culturally relevant way. That is our pursuit of health equity. And we're learning, more and more about the importance of these partnerships. But our opportunity really rests in our physical location and community, and how we make, national and local partnerships around the country. We've got over 30 national partners with, chapters all over the country. So, our North Star, where it works best is when our chapters link up with their chapters to do the work that the community needs. And that's what we believe our pursuit in health equity really rests.
Right. You mentioned a little bit about geographical barriers. Are there other barriers that you think are hindering the equitable health treatments and clinical trials? Maybe language or any other barriers that are challenges?
Absolutely. I mean, I look at these as, kind of multi-level, because there are, what we might call systemic, inequities, and that is, kind of long-standing, ways that people have, I would say, endured and survived, with a lack of wealth or, poor early life education or, low access to food and healthcare. These are some of the fundamental reasons why, some of these health disparities were created and, are sustained, and why African American and Hispanic, Latino communities may suffer disproportionately, higher rates of Alzheimer's and other dementias than other populations. So there's these systemic inequities that we really have to, acknowledge that have been in place for some time. And they lead to, things like, chronic health conditions, such as, diabetes or hypertension, other cardiovascular disease, and so we know that these systemic inequities lead to disparities in, poor cardiovascular health. And the research is telling us more and more that what's good for the heart is good for the brain, right? And so when people endure poor cardiovascular health over time, it puts them at increased risk for Alzheimer's or another dementia like vascular dementia or mixed dementia, Alzheimer's and vascular dementia. And so it's important to think about those factors that drive these disparities, but then there's also receiving a timely diagnosis, just having information and knowledge about Alzheimer's and dementia, and when it's time to go see a doctor, and trusting that you'd be treated fairly when you're going to see a neurologist or a dementia care specialist. We did a special report a couple of years ago, and we found that the participants in this nationally representative survey, this report we produced, that the Hispanic, Latino, and African American participants reported that they experienced racial discrimination when seeking dementia care, right? Wow. And so, right now we know that the treatments that have been FDA approved, they are for a specific time in the disease progression, and that's at the mild cognitive impairment phase, right? And so it is really important that people know about the treatments, they know about Alzheimer's and dementia, and they know when to go seek a diagnosis. And so if people feel like they'll be treated, unfairly because of their race and ethnicity, then we've got our work to do as a society and as a community to make sure that people belong in the dementia care system. And so, I think there's a lot of work that we've got to do at a policy level to meet some of these structural and systemic, barriers, but also giving people resources and the confidence to seek information, to seek a diagnosis. And that's the work that I'm really excited about my colleagues doing there in communities in Laredo at our chapter.
Yeah, absolutely. Because the sooner, of course, we can get folks on those medications that, like you said, are time driven. And if minority and underrepresented populations are not getting diagnosed or getting the information that they need for a possible diagnosis, and they're getting it too late, then they're just not going to qualify for those medications. And it's so important to get them on those medications early because, like you said, the criteria for that medication is some of it is early on stage.
And I want to follow up on that. You want to talk about you look at the areas of the country that have the highest per capita of people affected with Alzheimer's. South Texas, obviously, I think we had talked about top 10 in the country, right? When you talk about, and it's also one of the poorest areas in the country. So there's a lot of people who just do not have the financial resources to be able to go to a specialist, much less afford a lot of this medication that is coming out that is so tremendously expensive. Dr. Hill, how do you work toward finding some type of, and you talk about the resources, let's talk about financial resources. How do we make financial resources more equitable and more accessible for these areas that are disproportionately affected and are a little bit more challenged socioeconomically?
Absolutely, yeah. I tell you, we first and foremost advocate, for these treatments to be affordable and accessible by all people. And that's the work of the Alzheimer's Association. Really to advocate and lean on, some of these pharmaceutical companies to lower the prices and to make sure that everyone can have access, to these treatments. So that's first and foremost. But you mentioned, for the first time at the Alzheimer's Association's International Conference, this is where we bring scientists together to share all of their findings. This is the first time where, county level estimates of the prevalence of people with Alzheimer's dementia, in all over 3,000 United States counties was released. And so researchers found that the highest prevalence of Alzheimer's was in the east and southeastern regions in the U.S. And as you indicate, El Paso County, right there in Texas, was one of the top counties in the country with a prevalence rate of 15%. And so, the researchers suggest that a combination of demographic characteristics may explain the higher prevalence in these counties, including maybe an older average age or a higher percentage of Black and Hispanic Latino residents. But it's our hope that this information will help raise awareness of the urgency of the Alzheimer's crisis in specific communities. And you mentioned, lower socioeconomic, status, poverty. I look at many of these communities as, survival. I mean, really have endured a lack of resources to remain intact, to live, lives with integrity, and to move forward with families and communities. We've got to understand, the assets in these communities, the positive factors, and build on those so that we can get around this stigma as it relates to Alzheimer's and dementia, or give people, that confidence to go and seek dementia care or to seek information from our chapter. A nice middle ground is PV and our colleagues at the chapter level who are thinking critically about getting our resources, free resources, to communities. How do we, remain involved in community, understand what has worked well over time so that we can build on that and give people the resources that they need. Really important.
Yeah. Absolutely. Staying on the topic, Dr. Hill, what about clinical trials as far as making sure that clinical trials do include an equitable number of minority populations? We want our folks to be included in those trials as well. And I would think that the outcomes would just be, to be fair and equitable, you need to do trials on populations across the board.
Absolutely, absolutely. I tell you, it's really important to fully understand, the course of Alzheimer's and other dementia, in the United States. The trial, the research, has to be representative of the country and of the disease itself, and so as you mentioned, Black African Americans 2 times more likely to have Alzheimer's than older whites, Hispanic, Latinos 1.5 times more likely. And, we've talked much about diversity, equity, and inclusion, which, in certain places, is a lightning rod, for controversy and discussion. This is just basic public health, to fully understand the people who are most at risk. You won't understand the disease itself unless you include the people who are disproportionately affected or most at risk, right? And
exactly.
So it's a no-brainer, from my perspective, and we've got to do more, again, at multiple levels, right? This is not an easy fix, and so at a structural level, the FDA and other funding agencies like the NIH that really funds this research or approves these treatments for use, like the FDA, they've got to make representation in these trials a criteria for review. Really important that we move closer and closer to not being able to approve these treatments without proper representation. I think that's really important, and we're moving closer and closer to that. We certainly don't want to, slow down the scientific enterprise, but if we're not including the people who are disproportionately affected, we're not reaching the goals of protecting public health. So that's at a structural level. I think at an individual level, we know that there have been some bioethics atrocities like the Tuskegee syphilis trial or Henrietta Lacks situation in Baltimore. Many of medical malpractice in these studies that did not protect the health and the rights of African Americans and Hispanic Latinos have happened over time. So we've got to get over the stigma. We've got to continue to engage communities and let people know that there are protections in place now that really were different from the past. People can leave a trial at any time. And all of these trials have to be approved by a number of regulatory processes before they start, right? So the protections are different and are in place, and we've got to communicate that and continue to communicate that to potential participants so that they will participate. And I think the third one is at the researcher level, and so we think about many of these researchers, they're neurologists. They're not community engagement specialists like, PV and my colleagues there at the Laredo chapter. They're not, out in communities making partnerships with organizations. They're scientists, and so we've got to make sure that there are resources available, so that these researchers can hire community engagement staff to go out and do the work of creating partnerships and to really get around this stigma of participating in clinical trials. So it's, multi-level. We're the Alzheimer's Association. We authored the ENACT Act at a federal level, which would give many of the Alzheimer's disease research centers the kinds of resources to go out to hire staff who many times may look like the communities that we like to recruit, to go out and talk about participating in clinical trials, to really make an impact on the representation in these trials. And so, I think it's multi-level, and we're working at multiple levels to impact this very critical need, for equity and for public health. Really important.
Yeah, absolutely. As well as communicating with the minority populations and letting them know why it's so important for them to volunteers step up for these clinical trials, because we need them and they need those clinical trials. It could be a life-saving trial, but I think communication is absolutely important as well.
Absolutely. To your point, there are benefits thank you for bringing that up. There are benefits for participating in a clinical trial.
Exactly.
One, it gets you under a doctor's care for the duration of the trial, and then you could have access to these novel treatments
Yeah.
before they're FDA approved.
And can you imagine coming out with a positive benefit? I mean, wow,
Absolutely. So we've got to discuss the protections, the benefits, give researchers resources so they can get creative and engage in communities, but also holding, the regulatory and the funding agencies accountable for more representative research in Alzheimer's and all other dementia research. Really important.
Yeah, absolutely. We touched a little bit a bit ago, Jerry, on the report that had come out from the international conference. And I just kind of wanted to talk a little bit about that because it was mind-blowing when we discovered just how affected our area, it hits home when you talk about us. And that report clearly talked about us.
Yeah, and I remember that day that report came out, or I was walking in the newsroom. And anybody who's ever been to any newsroom knows that we've got TVs on all the different networks and all the different news channels. And so I was standing in the newsroom and I was looking at one of the walls, and on one of those we have CNN playing, and they showed the heat map of the different counties, and I see the big title, Alzheimer's on the graphic, and then I look at the Northeast and it's dark red. And then it kind of fades off a little bit into the lighter reds. But then I go to, obviously, you zoom into your hometown. I look at Texas, and I look at Webb County, and I look at the border, and there's that bright dark red again. Right. And when I saw that, it was just a very, it was just one of those things that just kind of impact you, and you see it, and it's like, wow. And it just kind of gives it a whole new meaning when you visually see it.
Exactly.
And I tell that story to a lot of people because I don't think a lot of people realize how affected we are here. We don't even have to say South Texas, because South Texas could be a lot right here in Webb County.
Exactly.
And it's amazing. And we talked about how, those are the numbers. It's like the census. Sometimes people don't get counted. Well, if we're at that, I'm sure there's a lot of people who aren't getting counted. So the numbers are probably worse than what they're indicating. Yeah.
And it goes back to educating the population on the signs and the symptoms, and then having them go to get diagnosed. So you're absolutely right. There's probably a lot of people who are walking around with some sort of dementia, not knowing they have it.
Yeah. Well, if I could weigh in here, in 2017, the Lancet Commission on Dementia, and just consider a committee of experts, reviewed the scientific literature. In 2017, they said that 35% of global dementia was preventable.
Wow.
35%, right? And they identified what we call modifiable risk factors. This was in 2017. And so those modifiable risk factors were less education in early life, so quality early life education, hearing loss, hypertension, obesity, smoking, depression, physical inactivity, social isolation, and diabetes, right? And so many of these, again, they relate to cardiovascular health or depression. Think about how people have coped with COVID-19, social isolation. And then in 2020, they added 3 additional modifiable risk factors, and that was air pollution, traumatic brain injury, which could link to, people's occupational status, how they work, over their lives. And then lastly, excessive alcohol use. And we talk about, coping with stress, all sorts of stressors, including, financial stress or, racial discrimination, all this stuff. So, when we think about, the elevated prevalence in any, geographic region, I think it's important to understand what we know in the science. There are modifiable risk factors that have been identified, and so then now it's, taking that so that public health programs can better understand and maybe pinpoint areas of high risk and high need, in specific communities, and then, maybe health departments can allocate, funding or staffing and other, resources for caring for people with Alzheimer's and other dementia, right? So I'm hopeful, given that the science is giving us some real ideas of what modifiable risk factors are. And then, this data at the county level can give public health programs, some real areas of direction for intervention, in communities.
Yeah, ever so important, definitely.
You talked about earlier, Dr. Hill, about the partnerships and everything that's going on. I've noticed lately there are a lot more Alzheimer's awareness commercials on. Whereas, even just a couple of years ago, I didn't remember seeing very much on television about Alzheimer's. I am seeing a lot of commercials on Alzheimer's and in prime slots, not 3 a.m. when a lot of these commercials, run. But I'm seeing a lot of Alzheimer's commercials, Alzheimer's Association commercials, talking about walk, talking about getting
research.
checked, talking about the research. Is that just me, or is there some campaign on to try to make more people aware about the Alzheimer's Association, and is that part of what you're doing to try to get the message to a lot of these groups of people?
Absolutely. When we talk about equity versus equality, equality is everybody kind of gets the same mailing about the association in our community forum. Some people will show up, but there are huge amounts of people will never open the envelope, right? And so equity is trying to understand how best to get information to people in the ways that they could use that. And we certainly have identified these commercials and ways on media, social media, to get the information up. For example, we're teaming up with the Ad Council on ads that encourage Hispanic, Latinos to recognize early warning signs of Alzheimer's and other dementia. And so, in partnership with the Ad Council and a creative agency, Lopez, Negrete Communications, we recently launched a public service advertisements, these PSAs called Some Things Come with Age. Some things come with age. And so the campaign is really directed at increasing early detection of Alzheimer's and other dementia within the Hispanic Latino community by raising awareness of the early signs and symptoms, which, as we mentioned earlier, is so important for, accessing these treatments in a very effective way. And this is important because the Hispanic Latino community is quickly becoming the fastest growing group of older adults in the United States. And, again, due to overlapping and, cultural barriers, systemic, long-ranging historic barriers that make access to diagnosis more challenging, early signs of cognitive change typically go, unnoticed or undiscussed in many of these Hispanic Latino communities and families. And too often, a diagnosis happens only in a moment of crisis or emergency. So we've got to get, this new creative. It is produced both in English and in Spanish, to communities. And so we seek to encourage, Hispanic, pre-care partners. That's anyone that's in close contact with an affected individual to recognize the early warning signs of Alzheimer's and other dementias in their loved ones. And so that's an example of how we're, trying to, get creative in this pursuit of equity to get people the information and encourage them and get them the information that they need. Yeah.
No, that is so important, definitely. And I know here locally, we were excited this year because we've got some younger members on our committee.
What are you talking about? We are the younger members.
We have a stellar person with Lorena Tellez, who has taken on the challenge of bringing in high school students and early college students, and we're excited to be partnering with her organization Nourish so that we could, try to see if we can reach through many different platforms that reach a younger generation, so we can let them know what they need to do to bring together the Alzheimer's community.
And don't you just love her spirit? We were at the press conference at IBC when they were going to make the announcement for the $50,000 donation to the association, and she just comes up to me and says hello, and she says, I want to do more. I want to get my friends involved. And it's so comforting and relieving to see that generation, that there are young adults like that, coming up the ranks. And I just wish we, obviously had more, but it's very reassuring that we do have, because we've got to grab them at that age, when as young adults. And to have that spirit and that drive to just want to help. I mean, that I'm sure is music to your ears also, Dr. Hill.
Yeah.
Absolutely. I'm encouraged by, this concept of brain health, and that really makes, Alzheimer's and other dementia, a life course perspective, right? And so protecting your brain health means, you're thinking about those modifiable risk factors, is making sure that, you know your numbers. You know your blood pressure. You're thinking about getting in physical activity, or that Mediterranean diet that so many of us strive for, but we may not meet all the time. But we understand that our lifestyle, and lifestyle is not only decision making. People need resources to make healthy decisions, but socializing the fact that lifestyle impacts brain health over time and could impact your risk for developing Alzheimer's or another dementia. And once we level set there, then the young people are involved, because they understand certainly of providing that support for a parent or a grandparent or a loved one, and certainly their own health over the life course. And so this is the public health push that I think is happening in communities right now, and the association is so proud to be a part of that with our chapters in many of these communities.
Yeah, and unfortunately, we don't do a lot of the Mediterranean diet. We do a lot of the Rio Grande diet, which I don't know if you've been to our neck of the woods, Dr. Hill, but when you're doing barbacoa, menudo, and all that good stuff, tamales, it's no wonder that diet is a challenge for obviously Hispanics.
And challenging.
There are you talk about diversity. I mean, our menu is very diverse from a lot of other groups, and it ain't diverse for the right reasons.
Yeah.
Deliciously diverse, I would say.
Yes, it is.
But again, that's a cultural strength, and that's something that we can build on in terms of identifying, those foods that are low in fat, low in sugar, and high in fruits and vegetables, and I know, that exists, in the diet there. And so, that's the kind of work that we can do in communities that tailors, this notion that, okay, the Mediterranean diet is, suggested for protecting brain health. How can we tailor what we know from that research to communities, to populations, so that people can at least know how to incorporate a healthy diet in their lifestyle for protecting their brain health. Really important.
Absolutely. I think we're coming to almost the end of our hour here. But before we let you guys go, PV, we have a huge day tomorrow. Can't believe it's here already. And I wanted to see if we can just real quickly tell the community what it is, and is it too late for them to be a part of it?
So we have our caregiver conference tomorrow at the UT Research Center, and we're very excited about this. There is definitely still an opportunity for people to register. They can also register on site, and we're very excited to have several partners that will be there sharing their information. We're excited for our speakers. Apologies, I don't have the agenda in front of me, but it is a day packed with a lot of great information and resources for our community in Laredo, for caregivers, for family members, for people who are curious and interested and would like to educate themselves. It's really going to be a fantastic conference. There are also CEUs that will be available for those who need the CEUs. So we're just trying to add everything that we can to this conference and hoping that we can continue bringing this to our community next year, and then, of course, moving forward. So if you go to our Facebook page, I believe the flyer is there, and it's Walk to End Alzheimer's Laredo. If not, I will post it, but you can either register now or you can register on site. So we're super excited about that tomorrow.
And just
and we can get that. We'll get that link onto our KGNS Facebook also.
Fantastic.
So with that way, if anybody wants it, they can go to our KGNS, and we'll have that certainly by the end of the morning.
Right. So, and I just wanted to mention it is from 9:30 to 9 to 3:30 tomorrow. Lunch will be provided, and it's over at the UT Research and Education Center on Bustamante Street.
And it's free.
And it is
free to attend.
Yeah, it is free.
And it's going to be a Mediterranean luncheon.
It's going to be a Laredo Mediterranean mix.
Tailored Mediterranean luncheon. Absolutely.
No, it's going to be a great conference. I know PVU and your whole group at the Alzheimer's Association South Texas chapter and San Antonio chapter have worked really hard in getting together.
Maxine has done a great job putting this together. Yes, with the programs team, we're excited. There will be several of us there from our San Antonio and South Texas chapter. We want to make sure that everyone has everything that they need. All of our pillars will be identified, all of our programs, all of our departments. So anything that you need, we will be there to hopefully help answer any questions and provide resources.
Sounds good.
All right. So we have done everything we needed to cover here this morning. Again, but if anybody needs additional information on anything related to WALK, if they need information related to the association, you want to volunteer, you want to be a sponsor, you want more information on diversity, inequity and everything we just talked about, reach out to the association. If you need medical help, medical assistance, there's a wonderful resource, PV. It's the 800 number. You want to remind everybody about the 800?
Yes, please contact the helpline 24/7, 365 days. That number is 800-272-3900, and there are master level social workers available to help you through whatever situation you are experiencing. You will talk to a live person.
You want to talk about diversity and inclusiveness and equity? There are how many different languages spoken on that helpline?
Over 200 languages.
That's amazing. Yeah.
Wow.
So someone's going to get the help that they need.
Yeah.
PV, thank you so much for being here as always. Dr. Hill, are you still with us?
Absolutely. Enjoyed the conversation. Thank you for having me. And thank you for your leadership and everything you're doing. So excited about WALK and the work that you're doing. So thank you. Thank you so much.
No, Dr. Hill, thank you so much for everything that you do for the association and for all the different people across the country who rely so much or who need so much all the help that we're trying to get to them. So thank you for being here and for everything that you do. And that is going to wrap it up for us.
I know, that's it.
These days just they fly by so fast.
They sure do.
It is amazing. And that is going to do it for us here this Wednesday. Are we here next Wednesday?
PV, I think we're taking a break next Wednesday.
The
following. All right, we're still on the bi-weekly.
Right.
I would imagine after our next one, we're going to go on a weekly and just really slam it until November the 4th. But again, PV, thank you so much for everything that you do as well. Mindy, any closing thoughts?
My closing always, if you've got anybody who needs to listen or hear this issue, just make sure, or this episode, just make sure you share it with your folks, your friends. It's always on our Facebook page. It lives on our YouTube channel now, so you can go back and view it as many times as you need to and share it with those who might need it. And remember, if nothing else, we are all in this together.
And the help is out there. So,
yes.
All right, we'll see you back here in 2 weeks. Have a great day, everyone.
Bye.